sleepy head. Wake up. Can you open your eyes for me? Hey. Just try and open your eyes for me. Oh, that's great. It's okay. You're going to feel sleepy for a little while. All right. The surgery is all over now. All done. And my name is Sarah, and I'm the Operating Department Practitioner that is looking after you in the recovery unit. Okay, so I'll be doing some checks on you and making sure you're all stable before I send you off to go and recover further on the ward. All right. You would have seen me earlier. Do you remember me? Okay. All right. Okay. Well, let me just give you just a few nice breaths of the oxygen there. Just take some nice deep breaths for me. There we go. Just help you wake up a little bit more. All right, so let me just take a little look at you. Okay, can you give your fingers a little wiggle for me? That's great. Okay, and how many fingers am I holding up? Lovely. Okay, can you see me clearly, or are you still a little bit blurry? All right, that's fine. Okay, well, you just relax. You haven't got to do anything. All right, and I'm just going to check you over. All right? Okay. I've just got your chart. And everything went well with your surgery. No complications. All right. So, firstly, I'm just going to check your blood pressure. All right. So I'm just going to pop a cuff onto your arm here and inflate that. All right. Okay. Just lie still. Don't worry. There we go. Let's get that round there. Pop the stethoscope in. Let's pop this onto your arm, okay, and I'll just inflate the cuff. That's fine. So, let me just remove the cuff. Right, I'll just make a note of that. Now, we've still got your ECG leads on at the moment, okay? That's just monitoring your pulse there for me. I'm just going to have a little listen to your chest while I've got the stethoscope in my ears. All right. Okay. just breathe normally for me. That's great. Okay. And we'll just check your oxygen stats. Okay. I'm just going to pop this onto your finger. All right, it won't hurt. There we go. That's all good too. You're checking out fine. So how are you feeling at the moment? Feeling a little bit chilly, okay. Well, we have a heated blanket on you, but I'll just pull the other blanket over as well. It's perfectly normal to feel cool after anaesthesia, okay? Be a little bit chilly for a while. It's just the effects of some of the medications and the surgery. Okay. I'll do that for you. You've got a sore throat? Okay. Again, when you have surgery, we have to put an airway in, okay? And although the surgeon is extremely careful with this, and the anaesthetist, they do their very best to do it without causing too much trauma, but the fact that you've actually got an airway down there, okay, for a length of time can make your throat feel very sore and scratchy for a little while afterwards. It's not an infection, it's just an irritation, okay. Now I know you're dry and you probably want a drink, but I can't give you anything just yet, okay. We just need to leave it a little while longer before we get you onto the ward and give you a drink, okay. Right, so let me just sort the extra blanket out here for you on top of your heated blanket. There we go. I'm going to take your temperature now anyway. Alright, there we go. The shivering should stop quite soon. Okay, so let me just use this device, just a thermometer. I'm just going to take your temperature. All right, I'll put it by your ear on your left side. You'll hear it beep. Okay, it's not going to go into your ear though. Okay, all right. There we go. That's all good. That's what we'd expect after surgery, so that's fine. Okay, lovely. So on a scale of 1 to 10, how's your pain at the moment? Okay, so you're in some discomfort, okay. Well, obviously, as the anaesthetic wears off, you're going to find that the pain does creep back a bit. But we have given you something during your surgery, but I can give you something more now to help keep that under control. I've got a list of medications which I'm allowed to give you based on what the surgeon and anaesthetist have requested. Okay, do you have any nausea at the moment? You are feeling a little bit sick. All right. Okay, again, that's a very common side effect from surgery and some of the medications, but I can give you something for that too, because what we gave you during surgery is probably worn off or about to wear off, so that might be why you're feeling a little bit yucky now. Okay, have you got any dizziness at all? a little bit lightheaded. Yeah, okay. So I'm just going to double check the meds. Okay. Right. So I've got those here. So before I go and check anything else, I'm going to give you some medication, okay, to make you feel more comfortable. Yeah? Okay, let me just double check your ECG is all doing well there. Yeah, all connected nicely. Okay, so just give me a moment and I'll sort your medication out. So you just relax, you can close your eyes if you want to. Yeah? Okay. Okay. So now I'm going to give you your medication. Okay, to get you feeling better. Alright. Alrighty. So the first one is going to be your pain relief, okay? And it's going to go straight into your cannula. Alright, the cannula is still feeling comfortable for you? Lovely. Okay, nice and still for me. Just keep that hand nice and still. I'll just pop this in for you. Alright. That's great. Okay, that's that one. And this one is the anti-nausea medication, stop you feeling so icky. And this one works really quickly. Alright, so again, it's just going into the cannula. Alright. Okay, keep nice and still for me. Lovely. There we go. All done. Let me just update that. Okay. That's fine. Okay. How are you doing there? Okay. Right, so what I need to do now, given you your meds, is I need to just check your dressings. Alright. Okay, you're not going to have too much area here, are you? No. I'm just going to pull the blanket back. Okay. There we go. Let's have a little look. Might feel a little bit sore for a while, but I'm not going to be pressing on too hard. I'm just really just checking the dressing. Okay, and there's no weeping or no bleeding from any sutures. Alright, okay. So I'll just a little press around there. It's quite a thick, comfy dressing you've got on. Okay. That's looking good. I'm sorry it's a little bit sore. But the beauty of the laparoscopic surgery that you've had on the abdomen is that it's far less invasive. The wound isn't going to be anywhere near the size of traditional surgery, and you generally will recover much quicker, so that's good. Alright, that's looking all fine to me. Let's pop that back. Right. Just going to have a temperature check on this side. Okay, just relax. All good there. You're checking out really well. So, once we've got you more stable here and you're back on the ward, I don't see any problem with you potentially going home later today. You're checking out fine at the moment. If the ward are happy with you afterwards, then they'll probably give you some extra dressings or change that dressing if need be before you go. But if you can eat and drink and you feel good and you're still checking out good on the ward, then you'll be able to go home later as scheduled. Yeah. Good. Okay, let's have just a quick check of the ECG then. Okay, before I remove those, I'm just going to check your blood pressure again. Okay. So, let's just pop the cuff on. Okay. Put the stethoscope on your arm. And inflate the cuff. That's all good. There we go. So you're feeling a little bit more awake now? Good. That's fine. Feeling a bit warmer now? Good. I'm going to remove this blanket now. Don't want you getting too hot. Okay. So, can you just give my hands a little squeeze? Perfect. Okay. Oh, I know. Well, as soon as we can get you on the ward, we'll get you some fluids. It's awful being dry, isn't it? I know. It shouldn't be too long now, okay, before we can let you take some fluids. And before you know it, you'll be eating something and then hopefully on your way home. The ward will give you all the guidance on the things to eat and drink and how you might feel for the next day or so and how to look after yourself. Because general anaesthesia, although you'll recover enough to go home, it can have effects on you for a little while afterwards. Okay, you won't necessarily notice them all, but it can have a first reaction on things like your actual responses, reactions. Okay, you might feel more tired, which obviously can be from the surgery too, but more tired, a little bit dizzy sometimes. Okay, so, and you've got somebody collecting you. That's good. Okay, because we couldn't let you go home on your own after general anaesthesia, as you know. All right, that's good. Okay. Well, I'm happy with everything there. I'm just going to check your oxygen sats one more time. Okay. So let's have that finger again. There we go. That's fine. That's fine. So I'm now going to gently remove your ECG leads. Okay, and I'll get the ward to come and collect you and take you back there. Yeah? What a relief. Okay, and they can further look after you All right, on there, just tell them if you don't feel great in any way, but they will be checking on you for a while. So I'm just going to remove the sticky pads off your chest, okay? Gently. There's one. Okay. Let's do this one. Okay. One here. Alright. You alright there? Good. There as well. Okay. Just this one here. Perfect. Okay, put those leads there. Right, I think I'm all ready to send you onto the ward, so I will leave you shortly and I'll contact the ward to come and collect you. Okay, you're feeling a little bit less nauseated now? That's great, okay. Hopefully that'll wear off anyway. And sometimes once you've had something to drink, a little bite to eat, that can actually start to feel better. Alright, obviously you're not eating for a very, very long time, but we can't have you eating before general anaesthesia, so... But once we're satisfied that you're going to be able to tolerate the food and drink, we'll make sure you've got something to fill your tummy up. Okay, so those checks all completed there. All right. Okay. Now, you lie back, relax. Okay, you can have a little snooze if you like, and I'll just contact the ward to come and collect you. Okay, and they'll look after you from there. Okay. Well, I wish you a speedy recovery, and I'm sure you'll be home later. All right then. Okay.